about a time when you worked with a patient whose family was never around. What did you do? How did that affect the patient? So those are the kinds of questions they're going to be asking. Give me an example when you noticed that IV was infiltrated. Probably all of us have seen that. What did you do? How did you explain that to the patient? What did it mean to the patient? And it may be, you know, I noticed the IV was infiltrated. I was so lucky, and the patient was so lucky. We were going to pull that IV within the next 250 cc's anyway, so we didn't have to restart it. So I got to tell the patient we were okay, but this is what we're looking for, and this is how we know it's not flowing well. Those might be examples you could use. Questions about the behavioral interview. Okay, just making sure we're tracking. Strategies for preparing for that, we call it STAR. So you think of the situation, the task, the action, and the result. So if you have all of those, you've covered. What does that also sound like?
You're successful.
Nursing process. Aren't we just so smart? So think that nursing process. You know that A&A book that you purchased with the standards and practices? That'll come back and haunt you the entire career that you have in nursing. Okay? So think that as you're thinking about these questions. That's what the people interviewing you want you to be thinking about. So that's a nice way. It can also be referred to, if you look in the literature, as SAR or PAR. It has the same 4 elements. So that's a nice way to kind of think through. What I do with my students, my senior practicum students, I make them sit down and write down 4 situations using STAR that they might use for an interview. So in your PEDS rotation, give me an example of something you did. In adult, 1 or 2 or 3, depending on which program you're in, what you title it. What did you do in mental health? What did you do in maternal child? So have a variety, but when you're interviewing, think about and process, what job are you looking for? What kind of a unit are you looking at? If you're looking for med-surg, I really don't want a PEDS example a whole lot. Won't help me a lot. If you're looking for a mental health job, I don't want a heavy surgical patient. That's not what's going to be on that unit. So really think about, what is the person that I'm interviewing with likely to be interested in? One of the biggest problems I have with students is you all forget to go onto the website for the institution you're applying for. You need to know their mission, vision. What do they stand for? What are they emphasizing? So you need to research them. Because if you don't, that's a really big turnoff for those of us that are interviewing. Really, you don't know what Penrose St. Francis, what our mission is? Who's our basic patient? Who are we affiliated with? What's our general service? What does our general community look like? Let's say you're planning to move to California. You need to know what their community they're serving looks like. Who is that general population? If you're going to go up to Denver and you're going to go to Denver Health, you need to know that unique population that they serve. 85% of their patients have no insurance. 54% of their patients speak Spanish as their first language. That'll be important for you if you're working there. And it's all on their website. So it'll all be contained there. So you have to do a bit of digging. Know what I'm looking for. I know in Denver, several of the hospitals are hiring to the float pool. Don't let that scare you. Their intent is that you will work for about 3 months on 3 different units. You'll float between them. And then, depending on where you fit in best, you'll get a permanent assignment on that unit. So if they're trying to best fit with the person and the unit, because you're also fitting in with the staff that you'll be working with. Maybe you don't like working with Cris Finn. She's a kook. Okay? She's really difficult. You need to kind of know that. Because each unit has its own personality. We may tell you we don't, but we absolutely do. And you guys know that from clinical. Right? Oh my gosh. They're so caring on oncology, and they're so understanding, and they take those extra minutes. In the ER, all they do is show them out the door. It's like, gosh, that patient's been here for 2 hours. Why are they here? Right? Because we've got 10 more coming. Okay? So kind of think about what fits your needs. What are you looking for in that first job? What fills your heart and your soul of working with patients? Because where you're happiest, you will do the best. So if you were to put Cris Finn on an oncology unit, for instance, we would not be happy. Those are not my special type of patients. Those are saints for nurses because they deal with end of life every single day. They deal with very difficult situations. I'm an ER trauma nurse. You know, I don't want to get to know my patients more than 1 day in a row. If you keep coming back, that's fine. I'll get to know you. But that's not what lights my fire. What lights my fire is, did we identify what you came in for? Can we get you in the right place? Can we start getting you care? Now it's somebody else's specialty to keep giving you that care. So please know each unit is unique and unto itself and is special. So when people, here's Cris Finn on a soapbox, if you say to me, well, I'm going to work med-surg for a couple of years because, you know, that's a background for everything else, med-surg is a specialty into itself. There are very special nurses who work on those units. So please never think, oh, I'm stepping down. Absolutely you're not. You're stepping up because they have a special body of knowledge that they use every single day. So please don't think that. Now that's a Cris Finn soapbox, okay? So I'll step off of it. But that's kind of my words of advice for that. Stress interviews are interviews that are designed to see how far we can push you to stress you. So a stress interview, some of us in the room have actually been through them. You'll show up for your interview time, let's say at 6:30. We won't take you in to do the interview till 7 because we want you to have to wait. So the stress builds. Okay, so it's a technique. We're building stress without physically hurting you, but we're building, you're like, oh gosh, I know I'm here, I need to pee again. All of those sorts of things. That may be also when we put 4 or 5 of you as interviewees with 4 or 5 staff, and then you have to answer in front of everyone else who's interviewing. And by the way, we be sure and tell you, only one of 6 of the 6 of you, only one of you is going to be given an offer. So you're looking around thinking, oh, gosh, I don't want to say they had the wrong answer, but I'd answer it different. Don't do that to yourself. It's designed to stress you. How do you work? How can you be a team player? What they're really looking for, can you be a team player? So you talk about your strengths, and you don't say a bloody word about everybody else's weaknesses. Okay? So that's kind of a technique. Might involve testing for your behavior in a very busy environment. So if we're in an extremely busy clinic, it may be a very logical interview technique. Air traffic controllers use stress interviews a whole lot because you got airplanes coming from everybody and everybody's waxing for a vector and everybody's asking to take off at the same time. And you've got to be able to multitask